Welcome to the Wellness Revolution podcast, the radio show all about wellness in your mind, body, spirit, personal growth, sex, and relationships. Stay tuned for weekly interviews featuring guests that have achieved physical, mental, and spiritual health in their lives. If you'd like to have access to our entire back catalog, visit drveronica.com for instant access. And here's your host, Dr. Veronica.
Thanks so much for joining in on another episode of the Wellness Revolution. You know, I'm Dr. Veronica. We're going to talk sports and being a doctor and the spoken word. This is a really interesting episode. Not that all the other episodes aren't interesting, but a little bit different because we need to laugh. We need to think more thoughtfully about how we do medicine, how we do our bodies, and we're going to talk about this. So I have a young lady here, Jamie Katuna, and I just ran across her somehow on the internet. You know how you surf around and you just run across something? I don't even know how I ran across her on the internet, but I said, she was just saying all this like sort of cool stuff about, I don't even remember what I was seeing that she was talking about. I don't know. Maybe to tell some of the stuff. Because spoken word about healthcare and medical topics. But let me just tell you what I love about her. She is a female athlete and played on a collegiate level basketball. UC San Francisco, I think I see here. She's been the captain. San Diego, first team all conference, first team all West region. I mean, just an amazing athlete. Now, I love that just because I feel like in my life, that if there's something that I could have done different, I'd have been more of an elite athlete. I really
nice. Mm-hmm. I believe you.
So Jamie, thanks for being on. We'll just like have a little chit chat here so the audience can get to know you. Let me just guys tell you in the show notes, I'm going to give you the link where you can find her. She's on Facebook. She has a website, but nobody uses website anymore. We just have a website because you're supposed to have a website, but we're all on Facebook, facebook.com/Jamie Katuna official. And what's going to happen, and you know, in the show notes, we will put the link so you can see her spoken word because she's got a lot of cool videos and over 1 million people have viewed her videos. So Jamie, welcome to the Wellness.
Thank you. Thank you so much for having me. I'm really happy to be here.
Okay, so you're going from fun basketball to doctorhood.
Yes.
First of all, tell us about the genesis of the basketball career?
I played basketball since I was a kid, and I was sort of an athlete too, like hyper competitive. It's just a great outlet for it. And then when I had the opportunity from high school to have my college paid for with basketball, it was just one of the coolest things ever. So that kind of became my identity for the last decade, really.
Wow. Okay. So now you're between basketball and medical school. Mm-hmm. So do you feel like a fish out of water?
Yeah, like a little bit. So like when basketball ended, I sort of had like an identity crisis type thing. Like, now what do I do? And I had one of the coolest conversations, and someone told me, it's not that you're losing your identity and now you have to make another one, but it's just like building on the identity that you already had. So it's like, you're still going to be an athlete. You still always will have been a basketball player. And now, like, what else can you add on top of that? Right. So it's not like replacing, but rather just in addition to.
So I've seen your videos with this, like, you know, fabulous spoken word, nice rhythm, and with the camera, and it's just like, okay, she is performing. Yeah. Not just like, she's not rapping about, you know, whatever people rap about the day that's inconsequential. She's performing about healthcare. Yeah. So first, before we talk about the healthcare piece of it, how did you start doing just these spoken word art form?
Yeah. So I would say like there's a couple things that sort of came together synergistically that kind of made that as the baby. So I like to read about healthcare and medical things, but a lot of times they come in long form written articles or essays, and it seems like it's interesting topics. Yeah, it's interesting topics, but it's actually boring to read, and it's like heartbreaking because they're not boring topics. It just gets really boring to read those things. So I'm thinking, like, how could you make something that addresses impactful topics, but in a way that people want to listen to, even a mainstream audience. And then I think that that came full form when I saw the musical Hamilton. Have you heard of it?
Of course.
Of course.
Yeah, well, I'm like jealous because everybody else has seen it except me, and every time I look, the tickets are like $700.
Yeah, no, it's ridiculous. But even listening to it, it's like educational, historical, you're learning something, songs in spoken word rap form, but you walk away from that and you've like learned a lot, but it's been entertaining the whole time. So I was thinking like, that is such an impressive medium. That's like, I wonder if I could do something like that. So that was the kind of the genesis of having read boring articles on the stuff that I'd like to learn about, then seeing Hamilton, and it was sort of like a light bulb went off.
Yeah, I'm trying to remember what I saw, because I remember you making some commentary about you were making a commentary about the difficulty of being a doctor in the current healthcare system.
Yeah.
Tell a little bit about that.
Yeah, so one of my mentors is Dr. Pamela Weibel. She lives in Oregon, and she's the founder of the Ideal Clinic movement. And she talks a lot about dehumanization in training and sort of how we treat trainees and how they kind of come up, and then the debt that they go into, and the bullying and the hazing and all that type of stuff, and the prejudice around it all. And so sort of having her as one of my leading mentors, I feel like I've learned that side of medicine at a relatively early stage in my medical career. And so I think addressing those types of things, like those are really like kind of emotion generating topics. And so it's good to get into that early. You know, people are more interested in that. And even people who are not within the healthcare system reaching out to me saying like, I've never known all that bad stuff is going on or whatever.
Yeah, it's funny because you talk about all that bad stuff going on, and it's like brings back those memories where I remember being a pregnant intern.
Wow.
And then having to go on to my residency, calling up the residency director because I was due in July. Called up the residency director, who was a female, and what she said to me is, it's not a good time to have a baby. And so therefore, instead of taking off a decent amount of time after I had my child, 13 days postpartum, I was on the ward. Now I think about how I would never want one of my patients to be doing anything 13 days postpartum.
That's it.
I felt the pressure from another woman physician to go to work.
Yeah. And that's it. And that's the hypocrisy around it. It's like you weren't put in a position to take care of yourself, to be healthy, and then we're expected to take care of other people and make sure that they're healthy. And sort of, how can we do that if we aren't even able to take care of ourselves? You know what I mean? We should be leaders and do yoga and do retreats and exercise, but also work 28-hour shifts and listen to all your authorities. And you know, like how can both be true? It's a ridiculous hypocrisy, I think.
Yeah, it's interesting because I thought also, you know, I went through all this. I went through that, went into preterm labor. So instead of delivering July, I delivered in June, a baby early, went into preterm labor because I was on call one night, working 100-hour weeks, pregnant. Okay.
Amazing.
All right. So then post everything, I'm in practice. And what I think now is, people are arguing with my office staff over co-pays, $10 co-pays. And I didn't get time to spend with my children. And they're arguing with me over $10 co-pays. I spent all this money, worked 100-hour weeks so that I could be the best doctor I could to give them the best care that I could.
Right.
And now a $10 co-pay is what they were arguing with my staff over.
Right.
How can this be? How people think that I'm their slave.
Yeah.
How did this happen?
Right.
Why are people so unappreciative of what doctors do? Where do you think that came from? You're not there yet, but you decided you want to go into it.
Right.
In your background, where do you think that came from?
Wow, that's like a really good question. And like, thank you for expecting that I would even have like an intelligible response around that. So, I mean, it could just come from the, like how medicine has become this patriarchal model, assembly line model, where doctors sort of just become robots in it. You know what I mean? Just deliver the care, like don't do any, don't take care of yourself, like ultimate self-sacrifice. And it just where kind of money rules everything, efficiency rules everything, and the holistic side of it, the person to person interaction, just gets completely erased from the equation. So that would be sort of my my like guess. Of course, I think it's way more complex than I would even really be able to fathom, probably. But
I know that's not. It's not. I'm asking rhetorically, and
totally.
You know, give it an answer, what you're seeing. But you decided, even so, seeing how medicine is, and it's still like what I'm saying. It's not changed a whole lot, but you decided to go into medicine. But also, I've noticed that you seem to be collecting around the group of doctors that tend to be more holistic.
Yeah, and that leave the traditional. So Pamela Weibel left traditional medicine. You left traditional medicine. There's another awesome surgeon named Dr. Sam in Florida, left traditional medicine. So that does seem to be, it's like the physicians who can be entrepreneurs and kind of learn that, like, no, I do not have to take this anymore. I'm a business in myself. I've gone through so much school. I know how to do this on my own. You're the happiest, and you guys are thriving. And I think that's the type of model, the type of mentors that I'd want to look up to. Like, I guess, what good would it do for me to get advice or surround myself with physicians who are really unhappy and stressed out? And, that's not, I feel like there's nothing really to learn from that type of physician. Although I don't blame them. I don't think it's their fault. I think they've kind of entered into a predatory system. But as far as my role models, no, I definitely have kind of surrounded myself by people who want to kind of pave their own way, in a sense.
Yes, I think that the public needs to understand that they're not going to be well and happy unless their doctors are well and happy. And
That's it. Yeah.
When you're in a traditional practice, all comers are your clients. Whereas in the holistic practice, we talk very much about screening who we work with. And it has to do with making sure that this person is going to be good for me, because bottom line, I cannot do a good job for them if I don't like them. So I remember practicing the old way. Whoever wanted to come in came in, because the only thing they did is they called and said, "Do you take my insurance?" And that was the bar. So first I felt like, you don't really care about me. If I don't take your insurance, you're off someplace else. So now, because I don't participate in insurance, but that doesn't mean that people can't afford me. They can. It's affordable. They figure out, but they have chosen that they want a relationship with me, and that they're going to compensate me fairly for my knowledge. But now I spend much more time with my clients than I did when I was traditionally practicing. And we have a relationship. I have ones that I miss, and when something happens to them, they reach out to me, and I help them through the rough spots of their life so that they don't derail themselves and get sick at that time. So it's much more satisfying. And I feel that my clients get great results. They get great results because, first of all, I make sure energetically and personality-wise, they fit with me. Versus when I see them on the schedule, I'm like, oh my God, that person's coming in. It's going to be a horrible day. And there were days like that. Oh, Mr. So-and-so's coming. Crap. The whole office would fit. When Mr. So-and-so was coming, the whole office would feel bad because so-and-so was a jerk. Now, so-and-so, I find out he's a jerk. I say, I'm sorry, I can't help you.
Right. And that's other businesses, other parts of society, the people who like provide the service in a way get to have the say of who they work with. You know what I mean? For some reason, physicians just don't get any say in who they work with, but then are completely responsible for the health outcomes. No, it does seem completely unfair. And I love just that, like, you're responsible for your own happiness. And it's like the physician that every pre-med kind of envisions, like, I want to be like this, and I want my patients to love me, and I want to love them. You know, you and Pamela Weibel and a handful of others are actually living that, are like living that example. It's just so unfortunate that's not the norm, you know, that you have to escape from the medical system in order to become the most ideal physician possible. You know what I mean?
So, you know, here's the bottom line. Every client deserves somebody to work with them. Everybody deserves to be someone's A-list client. And so that means that if I'm not the right person to you, there's somebody else who is the right person for you. And it's unfair for me to work with you if I'm not going to get along with you for whatever reason.
Right.
So
Yeah.
I look at my schedule and say, wow, I get to talk to Mrs. M today, or I get to talk to Mr. O today. I want to look forward to either talking to them or seeing them, because I know that I'm going to be playing full out for them, because you should love the people that you're interacting with them. When I'm in love with them, and we're not talking like, a love affair, kiss and huggy, but when I'm loving, now that doesn't mean I love that grouchy person. It just means that I've chosen that I can't work with that grouchy person. They're not the right person for me, but they are for somebody else, and they deserve to be with somebody who's going to love them and play full out for them. So if I can't play full out for you, I'm going to say, sorry, I can't help you.
Yeah. And I think that's so fair. It's like, if you can't be your best and thrive and be the kind of the most you can for somebody, it isn't even worth either of your time to be working together in a way,
Yeah. So, okay. So Can I put you on the spot? Can we get an example? Can you give us a little verse right here?
Oh, really? Do you have any piece that you would want the verse from?
You energetically figure out what you think would be the right thing to say to the audience, and it will be the right thing. It'll be something that people want to hear.
That is so funny. Give me a second to think of a piece that I would like to. Okay. The state of medicine now does not appeal to me. Lousy, crowded, inhumane, insane how we treat those in pain. They're confused, they feel abused, used by a system they didn't choose, coerced, forced to be treated like another digit, a statistic, a misfit. What is this? In the quest for efficiency, doctors must work relentlessly, endlessly, until they are spent and see no satisfaction, no chance for compassionate action. They can't thrive, just survive. Do what it takes to get by, demonized by eyes looking at them like, why can't you take more time to find what I am plagued by? The only possible reply, I try.
Thank you so much.
You're welcome.
It's interesting because one thing is, there's a statistic that's very sad. 75% of physicians at some time during their career become depressed.
Oh, I know.
And this is why they become depressed. And I went through a clinical depression myself when I decided I was switching over. Before I switched over, really, I was like, out of here. So I just thank you for realizing somebody speaking in a way. Hopefully more people will understand that, you know what? Doctors are people. They need to be loved and respected on a different way. They're not just a slave of the system, and they're not just your slave. And love us. I would be happy. I'm happy now that people say thank you to me, and that people tell me you're the best doctor I ever had. People tell me those type of things. That's better than any amount of money. When I was practicing before, people bothered to say thank you, that would have just been a nice day.
Yeah, amazing.
So
wow.
We look forward to welcoming more people like you into the medical profession. Maybe we could start a doctor basketball team. I won't be on it. I'm just, I'm height challenged.
You can coach.
I'll yell and scream and cheer, because I love watching sports on TV, because I love watching elite athletes in the competition. And it's also, in order to be a doctor, you have to have that level of discipline like these athletes have. You got to stick to it. You have to listen to other people. You're being coached all the time. Same with clients who get results. Team, I'm the coach. You listen to what I say, you will get the results.
I like that.
So Jamie, we'll put where we can find you on Facebook so we can see all your wonderful videos. Thank you for being on the Wellness Revolution.
Thank you so much for having me. I appreciate that.
Thank you for listening to the Wellness Revolution podcast. If you want to hear more on how to bring wellness into your life, visit drveronica.com. See you all next week. Take care.